my colleague Elise that you saw last time, is that right?
Yes, that's right, that is right, yes.
It was a little while ago, it was back in January, wasn't it?
It was, yeah.
And you've been referred to us with some bladder symptoms.
Yes, that's correct. It's bladder symptoms, and I think postnatal issues to do with the episiotomy, kiwi, ventouse, prolonged labour, catheterisation, inducement, and potentially a third degree tear, because I've recently done various different gastroenterological tests, which are found in 2 separate tests I've done. They found damage to my anal sphincter, and they've suggested that may be due to the episiotomy, because it was a big incision for sure. So that's something I'm concerned about too. Is these scar adhesions, because of the fact that I saw in 2024 summer, I saw Aisha at the Good Health Clinic in North Leeds, who is a women's health osteopath, and she was going to do a pelvic floor examination for me. She's very experienced, but she was unable to because my scar adhesions were too tender. And then she wrote it in an email. If I'd have been on the ball enough, I'd have printed these things out. But she essentially sent me an email afterwards, the women's health osteopath, saying that that there was something wrong with my scar adhesions. Like, there was tenderness to my scar adhesions. So it's essentially the main 2 issues I'm worried about is like general pelvic health after major surgery, such as childbirth. Very severe issues with my bladder. I did a private test in January that it found Klebsiella, Pseudomonas and Enterococcus, which is mixed growth, and I know I had mixed growth at the end of my pregnancy because the hospital told me. So ongoing issues with mixed growth in my urine, causing bladder inflammation. And then thirdly, episiotomy, scarring issues. Like, they're like the main ones from my perspective, but there may be things, like, I'm not the doctor, so there may be other things going on, but those are the main 3 sort of like urogyn pelvic issues that I'm very worried about.
Okay. And are you getting any leakage with your bladder at all?
The main symptom I'm suffering from really, really severely, extremely, is urge incontinence. Yeah, it's literally, it's very odd, but it's like going throughout the day, I'm needing to use the bathroom more, but it's not so noticeable. But when I lie down in bed at night, it's literally clockwork. It takes me about up to 6 hours to empty my bladder. And like, I've got arthritis, and I was lying in bed yesterday and my back nearly went because I'm having to get up every 2 minutes, literally 2 minutes, to empty my bladder. And it just seems to be that, like, at night time the water's just immediately flowing through me, and I know it's because of the UTI. I've got a UTI. It's not a short-term one, it's a long-term UTI, and it's Pseudomonas, Enterococcus and Klebsiella that are causing the UTI, and it's because it's complex. I have been on site for fluoxetine recently because I'm under the urologist here, but it didn't work. I think it might have been appropriate treatment for one of the 3 organisms, but for the other 2, it was for one of the 3 organisms. It was literally the only antibiotic listed was amokacin, and the urologist said to me that has to be through an IV. But I think that they wanted to prescribe the ciprofloxacin to see if that would have any impact. And then now it's kind of like, for that 3rd microorganism, the only thing that would treat it is amokacin. So I'm like not really sure what to do about that. But yeah, it's an ongoing issue with this UTI, and I think I've had it for quite a while, at least a year, and so it's causing me a lot of discomfort and pain and distress, preventing me from working, preventing me from sleeping, and lots of my childcare duties have been passed to my son's grandparents because I can't really do much. I'm quite high functioning anyway, but it's very debilitating at night time. I'm not really getting enough sleep. So yeah, but also just general pelvic health issues, like with pelvic floor strength, with you know, dysfunction. I know my ex-partner said he thought I had very severe like sexual dysfunction. I've been single now for a few years, but he did seem to think that was a real issue. So I think there might be something going on there as well with my muscles around the pelvic area, and I just would like to get to the root of the cause and try and do something about it.
Okay.
Whether it's particular exercises or what have you. So yeah.
Okay. And do you get any leakage of your cough, last things?
Yeah, I do get leakage for sure.
Every time you cough?
It's usually when I'm swimming, occasionally when I cough, sometimes when I sneeze, yeah.
Would it be every day, a few times a week, a few times a month?
It would probably be a few times a week, but the main issue is like a constant feeling of fullness in my bladder. Like even now, I've just used the bathroom because I did a urine sample, which have I given to you? Oh, they took the urine sample, yeah. And it's like just a constant feeling of inflammation in my bladder area, which is causing me a lot of issues, and also just ongoing. I went through the Women's Health Company DAYE day. They're fairly new and innovative, but they do like self-tests, and I sent off a self-test for vaginal microbiome, and it came back that like literally my lactobacilli, my vaginal microbiome was like sub-zero. It was so bad because I've been on so many antibiotics. I've had infections, and it also tested positive for bacterial vaginosis. And that's been something that I was also diagnosed with a couple of years ago. So that's causing me a lot of problems. And you know, it may seem that BV is something you can just buy stuff for in the pharmacy, but if it's left untreated, it can lead to infertility. So it is quite important that I, you know, try and remedy these pelvic health and, you know, vaginal health issues, because, you know, it could affect me long term. And I am getting older now. You know, I'm nearly 32 this year, and so, you know, I want to make sure that my pelvic health is as good as it can be, basically.
Have you seen anyone for that since you got those tests back for the BV?
I actually, have I seen anyone? I actually haven't seen anyone for that issue, no. I haven't, no. It doesn't seem to be routinely tested for. You know, like the tests, the things they test for when they're doing swabs is like mainly just chlamydia, gonorrhea, syphilis, oh god, what's the other one? Gardnerella. Like they don't really test for BV, so it's kind of, yeah, it's not ideal. I do need to see someone for these issues. It's quite difficult to you know, to find someone to see, or to know who to see, or to know how to book, like who to book with, and it's tricky because you know, because of all this trauma to my pelvis during childbirth, I've suffered a lot of stress, and it affects my brain. It really does. It affects my cognitive abilities to remember things and to you know, make executive decisions and to concentrate and to get tasks completed. It really does. So it's something I do my best. You know, I do the best I can every day, but that's just my reality.
It might be worth just if it's come back. How long ago was that test?
So that was a test I did in November. That's when it came back positive. Yeah.
It might just be worth flagging it with your GP and just request them, because at least they might be able to offer treatment first, and then if not, kind of refer on.
Yeah, I know for sure. Yeah,
any changes in discharge at the moment?
Well, discharge, because I've put on so much weight, so I've been all my life no larger than 63 kilograms. I'm 32 this year. I've never been larger than 63 kilograms. Suddenly my weight after giving birth ballooned up to most recently 100 kilograms, and I've lost 7 kilograms in the last 4 months because I joined a gym. But that means that things like discharge, periods, all of that stuff has just become like absolutely just like completely impossible to understand, because it's like my weight has changed so much. In terms of discharge, it's mainly it's mainly egg whitey. That's the kind of discharge. If I'm ever noticing discharge, it's sort of egg whitey. That's the colour it is, yeah. Jelly-like. And then I have been monitoring my menstrual cycle with various different apps, Flow and Clue, and basically I had amenorrhea for about just under 3 years after I gave birth. I did not have any periods at all, apart from an occasional random bit of spotting. And then I started to try and like regulate my lifestyle, joined the gym, regulated my sleeping pattern, and I have noticed that I had a bleed just literally a couple of days before Christmas, fine, and then the next month my menstrual cycle was about 2 weeks late, so that would have been end of January. Yeah, so that would have been the most recent bleed. It was like 2 weeks late, but I did have a bleed. And then now I wait, and I got a notification yesterday that my period's late, which it will be, but it is extremely anxiety inducing because every month I'm like, will I get a period, will I not? It could be another 6 months. I'm just praying again now that this month it would be 2 weeks late, and then 2 weeks late next month, and then I'll have some kind of regularity. But it's very scary. It is, you know, when this kind of thing happens to your menstrual cycle, it's really, really scary. Because mine was like clockwork before I had my son 3 years ago. It was like clockwork, you know, because I was always a healthy weight, and now it's just kind of like completely erratic cycle, which is, you know, causes a lot of anxiety and distress. So yeah.
Okay. And the leakage that you're saying with your bladder on the way to the toilet, how often does that happen?
So honestly, the leakage is mainly to do with me when I'm swimming. There's leakage. Okay. The main issue I would have is not so much leakage. It's urge incontinence. That's the main problem.
So you leak on the way to the toilet.
There isn't so much leakaging. No, there isn't any leakaging. It's mainly just urge incontinence. Yes, yeah, so it's like, yeah, that's that. No, I see what you're asking, because you think incontinence is when there's leakages. Yeah, sorry. So I guess, I don't know, maybe I'm not using the right term here. It's like a feeling of urgency to use the toilet, and a feeling of fullness in my bladder. So even if, for example, often at night time, I have to use the bathroom every 2 minutes, but I might go to the bathroom, and sometimes the flow of urine will be a lot. There'll be a lot of volume as well, and other times it will literally just be a dribble. But yes, it would have felt like it would have felt like my bladder was completely full. And I know when I did an ultrasound at the Avenue about 4 months ago, there was a residual volume of 14 millilitres of urine, which is, you know, not necessarily a sign of bladder retention, but it is definitely a sign that there's something going on with not being able to fully empty my bladder, because there was a residual volume. So it's not like, even when I'm like sitting here for 15 minutes going to the toilet thinking I've emptied my bladder, there's probably something still left over. So yeah, sorry, I don't necessarily think that incontinence in the traditional sense of the word was the right term, because it's not like I'm sitting here and I'm going to wet myself, urinate. It's more like I will have to get up and go every 2 minutes, and that's really, like, it makes it impossible to sleep. Like, I know for a fact that I won't be able to sleep for 5 hours until I have literally been, if you ask me how many times are you having to go to the bathroom before you're able to physically even think about relaxing to sleep, I would give you a number of probably 10 to 12 times. So, and it's difficult because I have recently been diagnosed with arthritis. I definitely do have arthritis, so it's really, really, really hard. I haven't had any occupational therapists come to my home and put like, what I need next to my bed is something on the wall that I can grab on so I can get out of bed, and I don't have any adaptations. So it's horrendous. It's seriously, I cannot emphasize this enough, and I really do need to emphasize this enough. What I'm experiencing at night time is truly, truly, absolutely intolerable, and absolutely, like sometimes it makes me feel suicidal. It is seriously that bad. It is seriously, seriously, seriously awful. And I can't stress that enough. I have to find a way of resolving this issue because I cannot carry on living like this.
Yeah, it looks like it's having a big impact on you.
Yeah, it is.
Any feeling of like a bulge or a lump or anything coming down out of your vagina at all?
Yeah, so this is something I did want to mention because, okay, so firstly I've got a lump. This is something I really, really need to mention because I've only just been able to I took some pictures of it a few days ago for the first time. I should have done it. I've had it for probably upwards of a year now. It's a lump on my bikini line area, but it's quite marked, and it's sort of getting bigger. And I do have a history of cancer in my family, so I am worried about that. And then also something I have noticed myself, inside the opening of my vagina is what feels like, again, almost like blisters. Not like in the sense of they're going to burst or anything, but it feels like they're sort of little lumps that are, I don't know how to explain it. It just feels like there's lumps in my vagina, and it's not ever been picked up on. Nobody's ever said anything before, but I've noticed a change. You know, and sometimes I do kind of think to myself, I know my body, and often doctors might not see these things, but I definitely know something has changed inside my vagina because it used to just be smooth, and now there's what feels like sort of lumps larger than. So the lump I have here on my bikini line is more like a smaller but quite protruding mass of cells, but then the lump inside my vagina feels kind of like it's bigger, and also doesn't feel necessarily like it's more like it's a dermatological condition. It feels more like it's something wrong with the muscles, or kind of like a prolapse, like something's sunk down, or like an allergy. I don't know, whenever I take pictures, it's always very red. My vulva seems very red, very inflamed all the time. I don't know what's causing that. I don't know if that's like vaginitis or something. But all I know is since giving birth and since, my body's changed so much, my hormones have changed so much, my life changed, my environment has changed so much, my relationships have changed so much. There's been so many changes, so I just think that, like I say, my urogyne pelvic health, I don't think it's very good, in all honesty. I don't think it's great, and I think there's quite a number of different issues going on that overall mean that there's a lot of discomfort and sort of just feeling of discomfort and so.
Okay. Are you doing any pelvic floor exercises at the moment?
I do. Because I was diagnosed with hypercontractility recently when I saw colorectal. Most recently, I was in the last sort of 6 weeks to 2 months, I was diagnosed with hypercontractility, which explains a lot of my symptoms because I also have IBS. So you can imagine the bloating is, like I say, intolerable, horrendous, but not as bad as what's going on at night with the urological. That's the worst issue by far that I'm having at the moment. But the bloating and the that has just been going on for 10 years, and it's awful. It's horrendous. And I was just thinking yesterday how much it's negatively affected my life, and how, because the surgeon was telling me that the reason why when they tried to do the flexible sigmoidoscopy in November 24 that they couldn't get the camera all the way round, that it was so agonising they had to stop the procedure, is because that's common for people with IBS, that they can't get through the small intestine because of the wind. And when they tried to scan my pancreas, when I looked at the report on the app, when they tried to scan my pancreas, they couldn't do the full scan. They could scan my spleen, and they saw cysts on my spleen, but they literally couldn't scan my pancreas because it was obscured by gas. That's what it says in the report. So that's causing me so much distress. And
pelvic floor wise?
Pelvic floor wise, so the point I was trying to make is that because I've been diagnosed with hypercontractility, I've been trying to do Kegels for quite a number of years. I've known about Kegels, but now I've also been trying to do the back passage Kegels, so just lifting the muscles up all the way into your lower back and holding it for 10 seconds and letting it go. but the problem is that I've got memory problems. So it's only if I'm listening to a podcast and it's like a women's health person and they start talking about Kegels, I'll immediately think, oh my gosh, let's do the Kegels. Or if I have the time, I don't have any internet in my home at the moment because all these issues are causing me. I haven't been able to work for 3 years now, so I'm living in poverty basically. But like on PIP, working capability benefits, universal credit. But my broadband's been switched off for 3 months because I'm in debt, so I have to pay that off for next 3 months, and then it will get switched back on. But until then, I have no internet, so I'm not getting as many reminders from being able to check my Clue app and my Flow app, which would be like every day for my memory issues, I would do these questionnaires on the Clue app. Have you exercised today? Have you done your Kegels today? How much water have you drunk today? And I do that every single evening. But for the last month, I've not been able to do that because I have no internet. I haven't even got the ability to make calls on my phone at the moment. So it's really, really affecting me. All of these issues are really affecting me, but particularly the bladder infection is the worst one out of all of them, I think. Yeah.
Okay. Was there anything you were expecting or hoping for from coming today?
I think Eloise or Elise said to me there may be like a pelvic floor check just to see for the strength. I'd be quite interested to know. I mean, I am very large, and honestly, I've literally moved into the gym. I've literally moved into this gym I've joined. I'm going there every single day. But the problem is that I am suffering with loads of issues with my life that you don't need to hear about, but I'm suffering with an inordinate amount of stress through various different circumstantial issues. So my level of stress at cortisol is very elevated, which means that it's really, really difficult for me to sleep, and it's really difficult for me to lose weight. And also the main issue is that the weight is putting a lot of pressure onto my pelvic floor, which will probably be weakening the muscles. So like anything I have like IBS, bladder infections, hypercontractility, episiotomy adhesions, all of these issues are worse because of all the extra fat that's pushing down onto my pelvis. But despite that, I would be interested to have just a barometer for how my pelvic floor is, and it would be great to see a women's physio in the future to get some exercises just to like strengthen it all up, so that when the weight is off, I've already done the work, because I think that would help my symptoms for sure, especially the hypercontractility. I think strengthening my pelvic muscles would be really useful. And I'm just intrigued. I've had endometrial biopsy surgery. I had flexible sigmoidoscopy. So I've had surgeries, and that may have impacted my pelvic floor. So I'd be interested to see what it, if you do like an assessment of my pelvic floor, because like I say, I couldn't do this pelvic floor assessment 2 years ago with Aisha because of the scar tissue of the episiotomy. So I would be interested to see if there's any changes if you don't notice that there's anything wrong with the scar adhesions, if you didn't do an assessment today, then potentially that means there's been some more healing that's happened, which would be very reassuring.
Yeah. Okay.
Yeah.
Should we do a vaginal examination then?
Yeah,
so,
okay.
Yeah, like you say, we can have a feel of your stomach to start off with, then I'll have a look just from the outside of your vagina, check your sensation externally.
Okay.
I'd get you to cough, push down, see if there's any weakness anywhere, see if we can see any descent from your vagina. And then I would insert one gloved finger into your vagina, get you to do some pelvic floor squeezes so we can see how strong that muscle is, see if it's relaxing properly, how it's functioning, how many repetitions you can do, and then hopefully we can come up with a plan as to
that would be
from
great.
here. Is that okay?
Yeah, that would be great. Thank you.
I'll check your urine as well while you get sorted, so we can just check the infection point of view as well.
That would be great.
Do you want the toilet at all beforehand?
Yes, please. Yeah, I was just thinking that would be great. Thank you.
Do you know where the toilet is?
Yeah, it's just round here. Thank you. Yeah, done. Do you want me to come in?
Yeah, if you've got a patient.
No. Yeah, no.
Thanks.
Hi. Just to let you know, I do put in these like probiotic little circular pills every day. I've been doing it for the last couple of days. If you see like some kind of orange powder, I've tried to get rid of most of it, but it's just one of these probiotic things that you can insert. So I've been using that to try and balance my microbiome and stuff. So yeah.
Okay. Well, if I do a minute, if you're alright to take your bottom half off,
okay.
have a lay on the bed, then pop this top sheet over the front of you,
Okay.
and then there'll just be a chaperone that will come back in with me. Is that alright?
Yeah, that's fine.
I'll just be a minute.
Okay.
Am I okay to come back in?
Yeah, that's fine.
So I've just got my colleague Sarah with me.
Okay.
Hi. You come in, get up a little bit, okay?
Yeah, okay.
You comfy there?
Yeah, I'm quite comfy. It's nice to have a pillow beneath my shoulders to provide a bit of extra support. I've got my back really went yesterday. I don't know why. I've got some I'm not going to do anything too vigorous exercise-wise today because my back felt very weak yesterday.
2 seconds. So I just have a feel of your tummy first, is that alright?
Yeah, that's fine. That's fine.
Can I get you just to roll your top up for me?
Yeah, yeah.
Any pain or discomfort?
Just floating, feeling of floating, yeah.
Awesome.
Oh, I do need to mention this. This is really important. It's something I'm really, really worried about, and I'm glad you've done this belly check. I have been getting in pain around here for quite a while now, and I am worried about it because it does come on suddenly, and I'm really worried about what it is.
Okay.
I don't know what's causing it, but it's literally like very localized to like here, and it's kind of like it's kind of like a very noticeable, like quite severe aching pain that just comes on like right here, and I don't know if it's my womb. I know I have a uterine polyp, but I don't know if that's it could be. If it's, I don't know, my uterus, it feels like it's a bit too far up to be my uterus, but
yeah, I wouldn't say it's anything necessarily to do with what we're looking at today, so probably just get you to
it's a bit high up
it,
for the gynae issues. Yeah, it's a bit high up, so it's probably more someone who does like abdominal stuff rather than lower pelvic stuff. Yeah. That's a whole separate new thing, I think, to be honest. So yeah.
Can I get you to bend your knees up for me?
Yeah, okay.
So I'll talk you through as I'm going along.
Okay.
Shouldn't be painful at all, but if you do want me to stop at any point, just let me know, okay?
Yeah.
Can I get you to relax this knee on me?
Yeah.
Okay. You're alright with that leg there?
Yeah.
Or if it's comfortable, you can relax it on the wall there.
Yeah, that's not too fine.
You're alright there?
Yeah, I'm okay, yeah.
I'm just going to check your sensation on the outside.
Okay.
So does that feel similar to that?
Yeah.
And does that feel similar to that?
Yeah, it does, yeah.
I'm just going to have a look from the outside. Is that okay?
Yeah, that's fine. Do you see the lump on the left of my groin area on the left? It's like on this side, like right at the top of my bikini line, like just on the lower side. It's like a lump of cells. That's what I'm worried about, that it's like cancer or something. Like just like if I just show you like there.
That area there?
Yeah, like you see this lump here.
Yeah.
Like a little more, like a little
skin tag.
Oh, is it?
Yeah.
Oh, okay.
Nothing.
Okay.
I mean, if you feel like it's changed or it's new or feels different to how it's been before, then again, I would get your GP to have a look at it.
Yeah, I might do that because it does seem to have changed a bit.
Different.
Yeah.
Any discomfort at all when pressing?
No.
That's good.
No discomfort when pressing.
Can I get you to squeeze your pelvic floor for me?
Like my vaginal muscles?
Yeah.
Okay.
Okay, relax.
Okay.
And when you're doing that,
Yeah.
are you trying to think about squeezing around your back passage, like you're trying to stop yourself passing wind, and
I'm
then
trying to do
tipping
the
forward to the
Kegels
front?
where you feel like you've got a bead and you're squeezing it as high as you can, like just squeezing the opening of the vagina. Okay. That's what I'm trying to do. Like I'm having a baby, just but not pushing out, just squeezing the baby in.
Okay. And then this time, if you forget about your Kegels completely, and you just try and think about squeezing around your back passage for me, like you're trying to stop yourself passing wind.
Okay, yeah.
Okay, relax.
Okay.
Can you do a cough for me? Good. And then can you push down as if you're going to open your bowels, or like say trying to push something out of your vagina? Does that feel difficult to do?
A bit, yeah. Okay. Yeah.
Are you alright for me to carry on?
Yeah,
So it's just going to be a little bit cold. I'm just going to set one finger, okay?
Okay.
Any discomfort for that?
No.
Good. Is it okay?
Yeah.
I'm just going to turn my finger around.
Okay.
Have a feel of the front wall.
Okay.
Feel okay?
Yeah.
Good. Anything that side as well?
Oh, no. My foot slipped down a bit.
You alright just to bring your
Okay.
leg up a little bit?
Yeah.
Okay. And then can I get you to squeeze your pelvic floor again? So sorry, just think about squeezing that back passage for me.
Back passage, okay. Yeah.
Good. And relax.
Okay.
Good. Yeah. And then this time, once you squeeze your back passage, can you think about zipping forwards to the front as if you're then trying to stop yourself going for a wee at the same time?
So sort of back passage and front as well.
Yeah.
Okay.
And relax.
Okay.
And squeeze again for me.
Okay.
And relax. And when you're ready, squeeze again. Keep holding. And relax. We'll just take a nice deep breath in, keep moving. Good. And squeeze again.
Okay.
Relax. Good. And and then when you breathe out, squeeze the pelvic floor again for me.
Okay.
And relax.
Okay.
Okay. Can I get you to try and do some shorter squeezes for me? So I just want you to try and hold it for a second and then let go.
Okay.
So you're going to squeeze and let go, yeah. And try and just make sure you feel like you're fully relaxed in that muscle. So you don't want it to feel like a bit of a kind of quick pulsing motion. You want to feel that squeeze and then that pull.
Okay.
Let go.
Okay, so squeeze and then try and keep that.
Yeah.
Pelvic floor muscles.
Yep. Squeeze and let go.
Okay.
And then can you do a cough for me? Perfect. Okay. That's it. That's all I need to do. I'm just going to take my finger out.
Okay.
We'll lower you down.
Okay.
I'll let you get dressed and sorted, and then we can have a chat for a bit when you dress. Is that alright?
Yeah. Okay.
You tissue here in regard to that, alright?
Okay. Yeah, I will. Okay. Thank you. Just get dressed then.
Yeah, get dressed and sorted. I'll just be a minute, and then I'll come in.
Okay. Did you notice anything with my physiotherapist scars at all, or did they feel?
It looks like, I mean, compared to what you were saying before, it looks
Yeah.
like probably more natural healing has happened. So
Okay.
when I was pressing on your scar, it wasn't causing you any pain or discomfort.
Yeah.
And it looked really, really mobile, didn't look really
Okay,
thick or
that's good.
hard. So that definitely looks like
That's
it's
good.
better. But I'll
Yeah.
let you get sorted, and then we
Okay.
can discuss everything when you're dressed. Is that okay?
Okay. Yeah, that's fine.
Am I right to come back in?
Yeah.
So, as I was saying, I think it is really reassuring that your scar looks really healthy, like it looks like it's healed really well. Like sometimes they can become thick and a bit firm and quite painful, but it looks absolutely fine.
That's really
I could
reassuring
press it,
to
I could
hear.
move it, and there was no pain, discomfort. I'd say that everything looks really healthy from that point of view.
Yeah, that's good.
In terms of the strength of your pelvic floor, we grade it on like a scale. So 0 is nothing, 5 is as strong as it can be, and I'd say it's like just coming into a 3. So you're doing the right thing when you squeeze your pelvic floor. There's just a bit of room for improvement for us to try and build that strength, that endurance up a little bit more. And I think possibly just from the previous trauma and scarring and healing and discomfort that you've had, those muscles are almost just really mildly just tensing a little bit all the time.
Interesting.
So sometimes when you're quite stressed, like you were saying, and you've got a lot of other stuff going on in your life, sometimes people can hold kind of like tension in their pelvic floor muscle.
Interesting. And how does that affect, sorry to interrupt, but how does that affect a woman who has that kind of condition with different things? Like, does it affect like your intimacy with your partner? Does it affect your your menstrual cycle? Does it affect how does that kind of affect your?
It shouldn't affect like your menstrual cycle or anything, but sometimes in terms of like intercourse and things like that, it can sometimes be a bit more uncomfortable and cause discomfort from that point of view. So
that makes sense.
The things that you're referring to in terms of like feeling like that there was a dysfunction, it might be that was kind of like picking up and kind of contributing to it. I think what's really good is after you squeeze your pelvic floor and you were naturally taking those nice deep breaths afterwards, I could feel your pelvic floor like letting go and lengthening and relaxing. So you can control it, and once you squeeze it you can then fully let it go. It's maybe just getting that link, if you have been a bit stressed and what's been going on, just thinking I need to just take a few minutes, and sometimes just having your hands on your tummy, just sitting at home doing a few of those really nice deep breaths into your tummy can just help to let it go, lengthen everything to kind of relax.
Is that would you say I had a diagnosis of vaginismus? Is that the term they use when? Is it vaginismus? I was reading about it. There was like an exhibition about it about vaginismus, and is that kind of what I have? Like some kind of spasm, like involuntary clenching.
It can be, and I wouldn't say it's you can control it quite well. So I would say there's a big spectrum of it, and I would say it's right it's very, very mild, but there is a bit of that vaginismus.
And how would you kind of improve that? Is it just through like relaxation?
It's just more the relaxation, and it is more that general like looking after your general well-being, your mental health and relaxation, mindfulness. If you've ever done anything along those lines, there's a massive link between like your brain and your pelvic floor, and trying to manage all those other stresses in your life can actually then help from a pelvic floor point of view. But I think also with us doing a bit more targeted like pelvic floor exercises and being aware of that, and then doing the breathing with the pelvic floor exercises should help to kind of relax that as well.
That would be really, really important. It's kind of like the gut-brain axis. But if I'm clenching, that means I'm stressed, and in order to reduce the pelvic floor dysfunction, I need to be less stressed, and that's what I need to work on, is trying to decrease that stress. But the problem is it's very difficult if your life is just generally quite stressful. It's about, I guess, making adaptations, making changes to try and just so that I don't have this stress all day, and especially in the morning, having that, like before I started to deep breathe at the end of the assessment, that stress often I'm carrying all throughout my day, every day, and it's no wonder I binge eat, and it's no wonder I have difficulties with relationships and have difficulties with finding work, and because I'm just like, you can see it through the pelvic dysfunction, my stress is just so on high alert.
So I think, and like you say, it's been like this for a long time, it's not going to suddenly change, but I think just having that awareness and checking in, and even if it's just 10 seconds that you take and you just you know, it doesn't have to be hours out of your day.
Mm.
It's just kind of checking in with it, you know, 10 seconds every few hours just to try and do it. So even if it's like, you know, if you've not got apps and stuff on your phone at the moment, just setting like little alarms, you know, regularly throughout the day to just be like,
that's
okay, this is my alert to just bring myself back to how I'm feeling, having a few deep breaths and, you know.
Because I think it's actually like, I honestly do think I've got post-traumatic stress disorder. As opposed, in addition to the generalized anxiety, which you can see through the pelvic dysfunction, I honestly do think I really do think I've got post-traumatic stress disorder, because I've been in situations like with like natural disasters and stuff. So I've been in environments where like I've been involved in like environments where it's been life-threatening, you know, because of like mass incidents. And I've had that a lot. I'm from London, so I've had that a lot in my life. So I do think I've got like post-traumatic, like a stress disorder. And that's really something I need to try and manage and get some help with, because I think that will really help the pelvic dysfunction, for sure. I really do. I really do think it would help.
That sounds like a good idea as well.
Yeah.
So with the pelvic floor exercises, what I would aim for is just to, rather than kind of thinking about the kegels, I would think more about that kind of front back passage, squeezing them together and feeling that lift. And I would squeeze and hold for 5 seconds. And I'll write this down so you've got it.
Okay.
So 5 seconds. And I would see if you can try and then repeat 5 of them.
Okay.
And then really easy, then 5 of the shorter, quick ones. But it doesn't have to be a really quick squeeze like I was saying.
Okay.
You know, do a squeeze, have a few seconds, take a nice deep breath into your tummy, let everything relax, and then do a squeeze again. Okay. So once you've let go of the squeeze, have a couple of seconds to do a couple of nice deep breaths, and then do your next squeeze, so you're not kind of like rushing through them as well.
So so for like the pelvic kegel, basically I hold it for 5 seconds, let it go, and then repeat that 5 times. And then I do 5 like quick pulses. Okay, that makes sense.
Ideally a few times a day, but even if we're hitting, you know, 1-2 times a day to start off with. Kind of getting it into a routine. If it's when you're laying in bed, you wake up before you go to bed, using something that kind of is a bit of a trigger to remind you to do it.
I really want to start doing these more often. I think it would really help me to not only just to prove my pelvic strength, but also it kind of makes you more mindful in a way. It's kind of like doing breath work if you're doing these exercises, because you're having to really take yourself out of your mind and focus on your physicality. So I think it would help me to do these more often.
And you know, if you go into the gym, you know, regularly as well, it might just be that, you know, whether you pull down or you add a few stretches where you know, like your child pose where you sit back onto your heels and kind of reach forward, or like a happy baby, or hugging your knees kind of into your chest, like laying on your back. You know, incorporating them into like at the end when you've been to the gym, and just having 30 seconds where again you do deep breathing in those positions can kind of help to just
for sure. So important. And I think first thing in the morning, honestly, I think first thing in the morning my cortisol levels are so elevated. And just because, you know, when you wake up in the morning and it's like I've got the cognitive confusion for everything that's happened with the trauma, then I've got the arthritis in my body, I've got the obesity, plus the circumstances, and like the financial worries, the relational worries, like the worries about my child. And honestly, like last night I had a really good night's sleep. I think I got like 9 hours last night. I've been averaging 5 hours for the last few months. I got a really good night's sleep last night, which is great. But I wake up in the morning and it honestly feels like, I feel like I'm like cross-eyed, because it's like the recovery that's happening through sleep is so vital and so important. But like, I just have to try and wake up in the morning and lower my cortisol and stress levels. And I think that doing the happy baby, and like you said, and doing the child's pose first thing, and doing some of these exercises, I think that would be such a good way to to start the day and to get off on a good footing. And I'm going to really try and implement that into my. I'm going to really start doing that first thing in the morning. Yeah.
Perfect. I think if we can, I don't want to throw too much at it at once, because I think, like I say, it's doing something that's realistic and that you're going to be able to achieve, and you know is manageable for you, and also remembering and not overloading yourself with too much. So I think that, if you agree, sounds to me like a really good starting point, and then we kind of review after a few more weeks.
100%. Because like I say, it's catch-22. If I do these first thing in the morning, if I do the breathing, if I can do the relaxation, that's going to help the pelvic dysfunction, the vaginismus, and then it will 100%. It will influence all the other areas of my life that I've just mentioned. Honestly, it really would. If I could just get the stress and the dysfunction under control of myself, my body, it would, I reckon within 6 months, all these other things I've just mentioned, they would probably fall into place. Because it's a dysfunction, you know, and if your body is dysfunctional, even if it's just in a small way, it always will manifest it in the other areas of your life as well. So although if the other areas of my life changed, it may help me with my body, it's catch-22, and you can only control what you can control, which is literally at the moment, it's just me, my diet, my body. Like, that's all I can really control at the moment. So that's what I need to try and focus on, really getting it to the best condition it can be. And then just hoping that there will always be some things you can't control in your life, but just hoping that it will at least help with some areas and make things a bit easier. And then you know, the dysfunction in my body becomes less, and then it's kind of a symbiotic relationship. So
yeah, definitely. Okay, so should we start there, and then if I request another appointment back with me, again in a kind of like month to 6 weeks, hopefully,
that
and
would
then we
be
can
great.
review and kind of see
that would be great if it could be a checkup, because I'm really going to try and do this. It would be great if I could come back in and have like lost, like, if it's in 10 weeks, did you say 10 weeks? Maybe like at least 5 kilograms in that time. So it'd be 85 kilograms, which wouldn't be obese, it would just be overweight, and then have a really strong pelvic floor. And less dysfunction in the pelvis, because I will be working on my stress. And then maybe I'll be able to think that life is a bit easier as well, which would be really great. So yeah, that sounds good.
Yes, I think, and being positive.
Yeah, for sure.
Is that okay?
Yeah, thank you.
That's
Thank you. I'm really glad I've had an assessment. I've been really wanting to have one of these for a really long time, so I'm really grateful that you've done this for me today, and thank you, because I feel a lot more empowered now to try and work on my pelvic health, which is really important. So see you soon. Yeah, see you soon. Bye. Bye. See you.